Anterior segment optical coherence tomography holds promise to become a gold standard instrument for corneal topography as its resolution surpasses that of many other techniques. The development of tools for correction of the distortion inherent to the technique and image processing tools have allowed to provide quantitative corneal topographies comparable to state-of-the-art instruments. In this study, we present dedicated tools for analysis of corneal topography in patients with keratoconus pre- and post-implantation of intrastromal rig segments. The high amounts of distortion present in these diseased corneas is particularly challenging, and even more the presence of intrastromal implants with a different index of refraction to that of the cornea.
The image processing tools include denoising for enhancing the contrast, statistical thresholding for separating signal from background, and clustering to retrieve the cornea and iris volumes. In addition, the algorithm is able to classify the data by their intensity values, allowing us to separate the most significant parts of the cornea volumes, as it can be, for instance, the anterior or posterior part of the cornea and the intrastromal rings if they are present. Certain surfaces are not quantitative since they suffer from two kinds of distortions, fan and optical distortion. All of them are corrected by a 3D ray tracing and fitted to different quadrics to produce the topographies and to retrieve their geometrical aspect.
The developed tools have allowed us to measure quantitatively the geometry and topography of the anterior and posterior cornea before and after implantation of intrastromal rig segments. The segments produce a flattening of the anterior cornea and some symmetrization and redistribution of corneal thickness within the optical zone. The correction of the optical distortion allows to quantify the backward protrusion of the posterior cornea behind the rings and to monitor the location and rotation of the segments.